Your signature includes the fact that you are a certified diabetes care and education specialist. I got it right on the first try.
Good job.
Do any of your appointments or discussions with your patients involve things like settings changes? Like that's part of the thing. And if you're licensed to like engage in that, like how far down the like specific um, diabetes treatment or diabetes management and treatment do you address as you're talking about the mental side of things? Do you also address the legitimate, not legitimate, but the actual sort of mechanics of diabetes management as well?
Yes, well, to a degree and to a limit. So I will not change somebody's pump settings or change somebody's basal rates. But sometimes I will suggest that they may talk to their doctor and want to increase their basal rate or increase their long-acting insulin a little bit. But I leave those decisions to the doctor. That's really not my expertise or my place. Where it does come in a lot is providing education about what diabetes is and how it's managed, and certainly some of the factors which impact diabetes management. Because I think and I'm a really big believer that diabetes education is a psychological intervention. If people are diagnosed with diabetes and don't understand it very well, and they're kind of, they're feeling lost, that's going to increase anxiety. And so providing good education about what's going on and how, strategies that people can use to manage diabetes better and more effectively, that gives people something to hold on to and something to, a feeling of more control over their condition, and a sense of efficacy that they have the ability to manage it well. And so to the degree where it's important and necessary, I certainly do. One thing I try not to do is talk about my own diabetes in treatment. Certainly, I don't, everyone's diabetes is, if you know one person with diabetes, you know about one person's diabetes, and my experience really doesn't translate to anybody else's. I do, however, one thing that I will do sometimes is show people my CGM graph, simply because I want to show people that I'm a professional here, and I do this on a daily basis, and I'm a certified diabetes care and education specialist. Got it right too. But my diabetes management, or my blood sugars, are by no means, always in range. And I think that's an important thing to have people understand, is that like it's okay that sometimes you're out of range, and I use that. One thing I will say though on that note is one of the challenges that we have with telemental health is looking at CGM graphs and looking at like kind of sharing those resources in person. That's one downside that we can't do that. It's harder to do it. You can kind of show your CGM graph over video, but sometimes it ends up being backwards and hard to see because of lighting. So,
have I a free solution for you if you're looking to view your patient's diabetes data? Tidepool.org/telemedicine. That was not a plant, but by the way, you can view your patient's diabetes data from the comfort of your home. And your patients can upload from home, by the way, as well. One more question from Christy, then I'm going to hide for a little bit. Thank you, Christy, for your question. Mark, do you recommend giving the diabetes distress scale during an appointment or prior to the appointment? What about folks who don't return it?
I believe that the diabetes distress scale is in the public domain, and so if they don't return it, I don't think that's a big deal. I mean, the only issue would be if they filled it out, put their name on it, and then left it somewhere for their own privacy. But yeah, I would definitely recommend giving the diabetes distress scale for two reasons. One is that so the therapist can understand kind of what's going on with that person at that point, and see if there are specific areas that they need to address. So for example, if the person has an upcoming appointment with their physician and they're scoring high on the physician distress subscale of the diabetes distress scale, that may be an issue that you can address during treatment. The other reason, which I think is actually just as helpful, is to be able to see change over time. Oftentimes within therapy, it's hard to measure progress. And so by using the measures over time, you can see and also show back to the patient, their improvements, so they can actually see if they're making progress, which for them is usually that provides them some hope.
There's also a couple tools in mental health that have been used. There's like the session rating scale and the outcome rating scale that are really awesome. Basically, they take like 10 seconds to fill out, and a person just marks it off. And you discuss it with the therapist or provider. And the research behind this shows that the client's perception of how the therapy is going is a better predictor of outcome than the therapist's perception of how therapy is going. And
Oh,
this is a way to surface concerns that the client may have, but may not say. But if you sort of externalize it to these tools, it allows people to, and then you can measure changes over time. So they're free in the public domain. We'll link to those when we do a follow-up blog post, but those are really cool. And my school is a really big fan of those.
yeah, that's awesome. I think that you hit the nail on the head there, that the patient's perception is much better than the therapist. I tell you, I see patients and I say, I'm not sure how I'm helping this person. I'm not really sure if I'm doing them any good. And then I will ask them, and they'll give me a list of reasons why they keep coming back, and how what we're doing is so helpful for them. It's always a surprise. It's always a pleasant surprise for me that that's happening. Both, and this is both in person, but also over video.
I'm wondering, do you have a way of asking that? Because I imagine that in the medical field, often a doctor might not ask a patient that, but it would be a lovely question to ask.
Yeah, I just say, I'm curious, how is this helpful, and how, and I also don't want to bias the question. So I say, how is it helpful, but also how is it not helpful? Because I want to open the door for people to tell me. I'm not fishing for compliments or fishing for praise. I'm really looking for feedback and really looking for understanding. But I also want to know, how things are not helpful and what's not helpful about what we're doing, because that's just as important, even if not even more important than what is helpful.
Yeah. There was this question I heard, I think it's more used early in therapy, but it's like, what would good therapy look like for you?
Mm-hmm.
And I thought that's also like a lovely question that would almost never be asked, at least in my experience, in the medical field. But in the mental health field, it's like, tell me, like, what would a productive, awesome relationship therapy look like for you?
Yeah, I think another way of asking that question is, what will you be able to do when we're done here that you can't do now?
Yeah.
Because if we're really looking for, and this is my perspective on therapy, if we're looking at, the person is seeking treatment because there's a barrier to them living the life they want to live, and we want to get them to the place where they're going to live that, be able to live that life. And so it's both a process, but it's also an outcome. And I think that they're just as important, but really we want to get to the outcome and not have the process last longer than it needs to.